This is my favorite topic to talk about because this is something that we can actually do something about. So let's get into it. Chronic pain is everywhere. It doesn't matter if you have a chronic illness or not. We need to know where we're starting from before we can start treatment. Well, it basically means listening to your body and taking breaks when you need to. When you have chronic pain, your energy levels are constantly fluctuating. Some days will be good days and you'll feel like you have more energy. Other days will be bad days and you'll feel like you have less energy. CBT teaches you how to identify and change negative thoughts and behaviors that contribute to chronic pain. For example, let's say you had back pain. They believe that the mind can influence the body and vice versa. And if you like this video, please share it with others. Thanks for watching. As a result, mind-body therapies often incorporate elements of relaxation, imagery, and meditation to reduce chronic pain. One common type of mind-body therapy is yoga. Yoga is an ancient practice that originated in India. It combines physical postures, breathing exercises, and meditation to promote physical and mental well-being. There are many different types of yoga, but all of them emphasize the connection between the mind and the body. Another popular mind-body therapy is Tai Chi. Tai Chi is a form of martial arts that involves slow, flowing movements. It's often practiced outdoors in a park or garden. Like yoga, Tai Chi can help improve balance, flexibility, and strength while also promoting relaxation and reducing stress. You might think things like, I'll never be able to run again, or I am so frustrated that I have to deal with this pain. These thoughts might lead to behaviors such as avoiding exercise or staying in bed all day. CBT can help you identify these thoughts and behaviors and change them to more positive and helpful ones. For example, instead of saying, I'll never be able to run again, you might say, I may not be able to run again, but I can still walk and bike. Instead of saying, I'm so frustrated that I have to deal with this pain, you might say it's frustrating to have to deal with this pain, but it is also an opportunity for me to learn more about my body and how to take care of myself. CBT has been shown to be effective in reducing chronic pain, improving function, and reducing opioid use. The key is to listen to your body and pace yourself accordingly. It involves inserting thin needles into specific points on the body to stimulate the nervous system and improve blood flow. Some studies have shown that acupuncture can be effective in reducing chronic pain. If it's a good day and you feel like you have a lot of energy, then go ahead and do the things that you need to do. But if it's a bad day and you feel like you don't have much energy, then don't push yourself too hard. Rest when you need to. The goal with pacing is to prevent your energy levels from dropping to low. When your energy levels drop to low, it can be really difficult to get back up again. So it's important to listen to your body and take breaks when you need to. If you're seeing a doctor about your chronic pain, they should be doing this. Exercise is one of the most effective ways to reduce chronic pain. It may seem counterintuitive, but when you exercise, you actually teach your body how to move more efficiently and effectively. This can help to reduce pain and improve function. When you exercise, you also release endorphins. Endorphins are natural pain relievers that your body makes. So even if you don't feel like exercising, it's important to try to do some sort of movement every day. Remember, you don't have to push yourself too hard. Start slowly and gradually increase the intensity and duration of your workouts over time. If you're not sure where to start, there are plenty of resources available online and offline. Your doctor may also be able to refer you to a physical therapist who can help you develop a safe and effective exercise plan. If you're not seeing a doctor about your chronic pain, then you need to get a baseline measurement of your pain. Physical therapy is a treatment that's often overlooked, but it can be extremely helpful for people in chronic pain. A physical therapist can teach you how to move your body in ways that reduce pain and improve function. They can also teach you exercises that you can do at home to continue improving your mobility and strength. In addition, physical therapy can help you with other aspects of living with chronic pain, such as pacing and energy conservation. And what does that mean exactly? Well, that means the first thing you want to do is get a journal. You can get a little notebook, you can use an app. You can even use an Excel spreadsheet. It really doesn't matter. And we're going to track 3 things: pain intensity, pain type, and pain location. Pain intensity can be tracked with a number. You can give yourself a number between 0 and 10, 0 being no pain at all, 10 being the worst pain imaginable. Now, obviously, pain is subjective and everyone's pain is different. So, whatever scale works for you, that's fine. Just keep it consistent. Don't change it up because that will mess up your data. Pain type. There are so many different types of pain out there. There's sharp pain, there's dull pain, aching pain, shooting pain, throbbing pain, cramping pain, pressure, tingling, burning, soreness, weakness, and stiffness. These are some of the most common ones, but if you feel like there's other types of pain that are relevant to you, go ahead and include those in your list. And finally, the third column is pain location. You want to be very specific with this one. You want to include the body part that's affected, the region, and even the side if it's relevant. For example, left shoulder blade, right knee, lower back, right foot, etc. Alright, so we've got our baseline measurement of pain now. What are we gonna do with it? Well, we're gonna look for patterns. We're gonna look for triggers. We gonna look for things that make our pain worse, and we gonna look for things that make our pain better. This is important because now we can address these triggers and avoid them. If there's certain movements that make our pain worse, then we want to either modify those movements or avoid them altogether. If there's certain medications that make our pain worse, then we want to stop taking those medications or talk to our doctor about alternative options. Same goes for stress and sleep. If we find that our pain is worse when we re-stressed or when we haven't slept enough, then we need to take steps to improve our stress management and our sleep hygiene. Chronic pain affects people from all walks of life, and there are a lot of different reasons for this. The point is that if you are someone who's suffering from chronic pain, it's not your fault. But what can you do about it? That's what we're gonna be talking about in today's video. So let's get right into it. No, 1, we need to get our baseline measurement of pain. Number 2, pacing. Pacing is a really important skill to learn when you live with chronic pain. What does pacing mean exactly? Number 3, graded exercise. No, 4, physical therapy. Number 5, cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is a type of talk therapy that can be very helpful for people with chronic pain. No, 6, acupuncture. Acupuncture is a form of alternative medicine that's been used for centuries to treat chronic pain. Number 7, mind-body therapies. Mind-body therapies are treatments that focus on the connection between the mind and the body. I hope you found this video helpful. If you have any questions, please ask in the comments below.